If you see these spots on your hand or wrist, it means you have 5 years to live. Just kidding. So that's what I told her because she didn't know that what these were. It's a patient of mine. She's going to be having surgery in a minute. But as I was marking, I just noticed these little bumps here. And I asked her if she knew what they were. And she said she didn't know what they were, but she also noticed them in a friend of hers who was working out a lot. And she said that she noticed them in herself when she started working out a little bit more. And so you see this commonly in patients that work out and that are thin and they don't have a lot of body fat. And what these little bumps are they are valves in the vein. So you can see she has, veins that are coming up here. Everyone has these veins on the dorsum of their hand. And then this is another vein. It's a large vein that comes up here. We used to call this the intern's vein when we were in residency, because if you can't place an IV, usually everyone could put it in this area. And so these are just the valves that are here. And if we even block the way the blood is coming out of her hand, you'll notice that the veins start to swell because the blood is not able to get back, and these will become a little bit more prominent. So what are these veins? Now I let go and you can see the veins collapse. So what are these little valves doing? Well, the veins, this is a low pressure system, and the veins are returning blood up her arm back to her heart. The arteries, that's why you can feel the pulse here of the radial artery and the ulnar artery on the other side, are bringing the blood down. So as the blood is coming back, it's under low pressure, so it's a very soft, low pressure system, and as the blood is being felt by the pumping of the heart, the blood will move a little bit. And then to prevent it from going back down, it will hit one of these valves. So the valve will open and allow the blood to come back to the heart, and then as the fluid passes through, the valve just closes. It's a one-way valve. We have those in our house, our plumbing and everything else. It'll let fluid go one way, but then when the fluid tries to come back, this little valve closes. And so that's what these are. Those are the little valves in the vein, and we can see them on patients that are very fit.